Welcome back to the Welcoming Womb podcast. Can we talk about one of the most grueling pregnancy experiences that women can go through and one that gets the least amount of care and support? This would be hyperemesis gravidarum or extreme morning sickness. And I remember back when I was in nutrition school at the Nutritional Therapy Association, in one of our questionnaires, which is something actually all my clients work through, one of the question was having a history of morning sickness. And we actually had a reference book that went along with this questionnaire, and it went into the imbalances in the body that history of morning sickness could indicate. It actually was specifically associated with the liver gallbladder pathway. And that just blew my mind because my whole life, everything I'd always ever heard is that we don't know the reason for morning sickness. There's nothing really you can do to prevent it. We really just, it happens to some women, it happens to others. And that was such an aha moment for me, understanding that, hey, there's more to the story. And there are always answers to these problems, and people just haven't bothered, haven't bothered to look. And so today, knowing that there is an answer to such a devastating problem that can impact women, I knew I needed to bring on Jess from, she's a root cause physio from the Wellness Element is her Instagram handle, but she actually experienced severe morning sickness, got an HD diagnosis, and she resolved her morning sickness symptoms in as little as a day. And went on to have a happy, healthy pregnancy and her dream home birth. And so I'm so excited to bring this story of hope and to bring resources to any of you listeners who either are experiencing severe morning sickness right now or are afraid of going through that experience or repeating that experience in a second pregnancy. So I cannot wait for you to dive into this conversation I had with Jess. Welcome, Jess. Welcome to the Welcoming Womb podcast. So Jess is a registered physiotherapy and board certified holistic practitioner. She has transitioned her practice towards root cause healing after slipping through the cracks of the Western medical system on numerous occasions with her own health. She shows her clients how to become their own healer by understanding their body through the lens of biomechanics, epigenetics, and energetics. And I'm so excited to dive into that deeper with you, Jess, today. So welcome.
Thanks so much for having me on, and I'm excited to chat.
Okay, well, perfect. So I think to just start off, let's do something fun. Do you have a drink of choice with you today? Do you have a hydrating or beverage?
Water with some minerals. Now, usually I'd have a green juice here, so I can get my folate in, but today it's just water.
That's okay. We're in the perhaps slightly rushed boat, which is me too with my water and minerals, but in glass too. I love it. So just a little fun question to start us off, but I'd love to give you an opportunity to share your story. So I want to hear you talk about, how you slipped through the cracks of the Western medical system. And I'd just love to hear your experience of, what that looked like for you.
Yeah, so I think we're going to dive into it more, but most recently it was with the HG stuff during my pregnancy. So hyperemesis gravidarum, or a severe form of morning sickness. And, just being really told that the only option is to take medication, and the medications that they want to give you are not tested for safety during pregnancy. So just seeing that was really the only option they had, and of course no explanation, but that was to be expected at that point in my journey. If we jump way back, I mean, the first thing that really pops out as one of the biggest events was I was in university. I was an athlete. I was in really great shape. I was a wrestler and a rugby player, so I was, used to tough things. And I had this like kind of 2 week span where I really didn't feel well. I had a therapist at the time, like an athletic therapist and a sports medicine doctor that worked with our team. I'd seen both of them and they couldn't really pinpoint what was going on with me. I got sent for an MRI and X-ray. I was complaining of low back pain, but kind of just like my whole middle of my body just feeling really restricted all of a sudden, really abnormal. I ended up going to Emerge in that time 3 weeks, or 3 times over the week, sorry. And each time being sent home, if you haven't taken Tylenol and Advil, it must not be that bad. Go home and do that. And I said, no, you're not understanding it's not that type of pain, or you've pulled something, go see a physiotherapist. Meanwhile, I'm in the training to become one. I'm no, it's not that. And so it wasn't until, I laid in bed for 2 days. I ended up going to a walk-in clinic and they sent me immediately to the hospital saying that either my appendix was ruptured or a cyst on my ovary was bursting, but something quite like medically significant was happening. I still waited to Emerge for 6 hours with a doctor's note, but eventually, about 10 hours later, they diagnosed me with an appendix rupture. I was scheduled for surgery. I went in, I woke up after surgery and it had been a 5-hour surgery when it was meant to be about 45 minutes. Just to clean everything out. And their explanation was, why didn't you come in sooner? Didn't you have pain? And, looking back, I'm like, yeah, I was here 3 times this week. Yeah. So just really that one experience kind of being the first time that something big enough happened. And then later on, I ended up having an injury following a needle and going to the doctor. I was sick for a couple of weeks. And it kind of brought on a lot of past post-concussion symptoms I had. So in university, I had a concussion. Later on in my physiotherapy diploma, I did my education in England. I had to be up to date on everything, routine to work with, patients. And there they have a different schedule. So I had to get a live, I don't want to say the word just in case it censors, but just for TB. And that ended up being that, someone with autoimmune issues isn't really supposed to have live ones. So that put me into a bit of a spiral. I ended up having like a relapse of all of my concussion symptoms, in my placement, getting asked if I have a traumatic brain injury at the time, just because of how it changed my processing and different things. And then coming back and really dealing with all the autoimmune things that came around with that. So I was having swollen glands in my throat, probably every 2 to 3 weeks. I was sick at least once a month, typically 2 times a month. I had rashes all over my body. I sneezed about 200 times a day for 10 years of my life. So going to the doctor and saying, like, I'm headed down a bad path. I really want to get on top of this. Who should I see? What should I do? And being met with, you're young, you're normal, your tests are normal, it's probably fine. The things you're complaining about aren't that big of a deal. And so that was 3 to 4 years of my life. And when I really prompted them and say, everything is so consistent that it has to be something I'm doing. Like, is it food? Is it an environment that I'm in? There's something that's consistent enough. And the doctor turned to me and said, we don't consider nutrition as part of medicine. You know more, having taken a science-based diploma or degree than we would know.
Yeah.
And that was a light bulb moment for me. You wouldn't go to a mechanic and say, like, I put orange juice in my gas tank. I don't know why it's not running. They would, they would laugh at you. So that was my light bulb moment of like, okay, I'm getting nowhere. I need to take matters into my own hands. I took my nutritional therapy diploma, learned all about epigenetics, learned all about nutrition, and then, just kind of worked through the process of myself of saying, what is it for me? Is it, I thought personally it was Hashimoto's, lupus, or Lyme, and then kind of going with what will help all of them. And I'll just start tackling that list. And then, healing and then helping other people to do the same. And then fast forward to HG, kind of going into it with that same mentality and just really, saying, what can I work on? What's in my control? What's in my power? And going for that.
Well, thank you, Jess, for sharing that. And I didn't know that the full breadth of your story. I mainly knew about your HG story from what I had seen on your profile. And a big thing that I see in that story that I see so consistently is the way that women's pain is diminished.
Yeah.
Right? Yeah. Undermined, diminished, not taken for granted. And I saw a figure recently, but the vast majority of chronic illness sufferers are women. And
Yeah.
I just see this consistently, even in extreme, either with ovarian cysts or things like appendicitis. When I, um, and you're trying to seek care and your pain is just not viewed as valid or something that's deserving of support. And I see this so consistently during pregnancy as well. It's a big
Mhm.
motivator for my work. And so your story speaks to that need. And I really appreciate how you share how you found your own tools to overcome that. Um, but I just always like to point out, like, when there's these bigger systemic problems that these stories are speaking to, just
Oh,
bringing
totally.
that, to mind, especially of the women listening, because I'm sure there's a lot of women listening that are in a similar position, right? It might not be HG, it might not be, maybe it is if they're listening to this episode, but it might not be the exact symptoms you're dealing with or the exact same causes, but they're in that position where they don't feel well in their bodies. They know something is wrong, and no one is helping them, right? No one has answers. It's like, exactly, it's the your orange juice in the inch. I love that. I love that one. It's so funny, but right, it's like they know we need, it's like, I can't just run this on motor oil, like I need something else, and all the doctor sees is like motor oil or gasoline, or the check engine light's not on, so everything must be fine, even though the car sounds like everything's falling apart. So
Yeah.
thank you. I really appreciate you sharing that. I'd love, take a breath. I'd love to hear more. I'm gonna work out when I speak to take a breath and a pause. But I'd love to hear. So we had this first journey, and you again. So we and we're your new remind me of your nutrition certificate specifically, because we're both nutritional therapists, but we have different certificates based on my certifications based on my understanding.
Yeah.
Feel
So
free if you want to talk about like that education and what that did for you, or how that helped you on especially your first autoimmune journey.
mhm. Yeah, so I think I was fresh out of physiotherapy
Yeah.
school. I came back to Canada from England. The food system's a bit different here.
Yeah.
So I had an influx of symptoms kind of creep
Mhm.
up on me here. And it made everything more apparent in terms of my autoimmune issues. So when I got told that food really isn't part of it, I just felt like it was a light bulb moment for me in the sense that I'm barking up the wrong tree for the answers I'm looking for. And it sparked me to kind of continue on. I had started a nutritional therapy diploma
Mhm.
through like an international certification in the UK.
Mhm.
And it was online, and I just kind of put a pin in it. It was stuff that was building on things I already knew in my kinesiology degree. And so I really didn't have the full picture moment of it yet. So once I had that experience and just, my lived experience of something more is here or something's happening, it prompted me to like dive back in with fresh eyes and really finish the second half of that diploma. And so with that, it was really based around epigenetics and around the
Very cool.
idea that your environment, whether that's your food, your physical environment, emotions, things like that, are really drivers of your genetics. So your genetics may be 5 to 30% of your health profile, but what turns those on, or what makes those genes turn into a disease, is actually those lifestyle factors of your nutrition, of your environment, of the relationships that you hold. And so that gave me a lot more power to really understand that I had so many more cards in my hand than you are taught. And I think, this is a side piece, but like you said, how women's pain is diminished, and we're both passionate about the pregnancy piece and it's starting off, but I really do think it starts at pregnancy. And for us, it started from our birth, right? Like we are typically, like, women are told that the power lies outside of them. It's in the doctors and the experts that know better for your pregnancy. It's in the pediatricians that know your child better than you. It's in, the education system that knows more than you. It's everyone else has the knowledge, and you're just constantly a user, or like you're accessing that. And the degree really changed my mindset in the sense of like, no, I actually have all the cards in my hand, and it's my job to understand them and play them out how I want to. So yeah, I think that education just really gave me a set of fresh eyes.
Yeah.
it prompted me to, at that time, I'm trying to think back in like my healing journey, because it was just like
Yeah.
rabbit hole after rabbit hole after
Yeah.
rabbit hole of health at that point. But I got really big into gut health after that, learning
Mm.
about the microbiome and everything. So that kind of steered me in that direction. And then obviously learning about detoxification, and now where I'm at, my journey is a lot more in terms of like the emotional and the traumatic influences on our health and on our organ systems. So it's always constantly evolving. But when I think about the place I was at that time, it was really just that shift towards, I have the power, I have so many things I can control, and why don't I start with that?
I love that. I love that journey. And I like how your program has the epigenetic focus. It sounds very interesting because something that was, covered in my education, but it was definitely not the primary focus. It's definitely a very interesting topic. I love the work of Dr. Ben Lynch. I'm assuming you're familiar and a fan.
Yeah.
And I know you are from some of the things you've posted, but I love his work. His book, Dirty Genes. I'm sure it's on your desk. Mine's like right up there.
Reference it all the time. So it's just here. I got it.
Mine's
You're
up
so
here.
funny.
Um,
It's such a key piece for me. Like I have like the 2 or 3 books that I'm always like, you need to get these
yeah.
books to people, right? If you want to start to understand stuff. So yeah, when we get into the HG part, like definitely he was a key factor.
Oh, I love, yeah, and we're gonna get into it. Uh, I love, I'll get completely on a tangent, but I think what one thing, when I read books like Dirty Genes or, cases like he has these genetic profiles and you read the book and he's like, and it's not just, oh, this is what you'd get on a test. It's all these different symptoms and personality traits and just life experiences. And you read the book and you find the ones that are yours and you're like, oh my gosh, that's me. And he tells these stories of people that have lived their whole life living an existence that, yes, they have some genetic factors that are contributing to that, but once he gives them the right support, like their existence completely changed. I'm forgetting the exact, but he had one story of, it was a lady and she was always she was like classic MTHFR and kind of always very dull, like not super, just like never got very excited. That's the Cliff Notes. And he, gave her some simple supports for MTHFR. And it's like her parents were calling him up, like, what have you done to our daughter? Like, she's a completely different person, and not in a bad way, like in a shocked way. And I think we can bring this conversation back to, for women that are in the preconception period, just understanding like that lifelong impact, or how the choices you can make and the lifestyle you create for your family could lead for both you and your child living a lifelong existence that isn't really what is you. Does that ring true to you, Jess?
Yeah, I think definitely there's things, and I'll tie 2 pieces together because I definitely love that take on like we can have these personality traits, maybe being a type A, or more neurotic, because women get
Yeah.
called that sometimes, or just that need for control. And we think it's us and we think it's a flaw of us. And we don't realize that it's our body operating on a program
Yeah.
that it only has the tools to operate on, right? Like you can't expect my Mac computer to run on a Windows program if it doesn't have Windows in it.
Yeah.
It's not going to work that way. And I also think, moving into more of like the energetic stuff that I've been learning about lately, we see the same thing, in human design. That was something for me that came up of like, I'm a manifester and my strengths are ideas and the like starting and the initiation. And I'm really bad at kind of the follow through or like the mundane aspect of keeping it up at the end, right? And so I could spend my whole life beating myself up and being like, why can I never finish something? Why don't I like see it through to the end? Why do I get excited about the next thing and jump
Yeah.
into it?
Yeah.
And you beat yourself up over who you think you are. And it's these things that are all building blocks of who you are. And when we think about that in genetics, like those building blocks can be painted a different color. They can be built faster depending on the tools you have. Your body is always working for you. And like nothing in nature has like a kill mission. Like these trees and like tomorrow I'm going to self-destruct. Everything wants to heal, it wants to be healthy, it wants to be alive, and it can only do that to the capacity of the building blocks that we give it. And so understanding that when it comes to genetics, you know, even in more recently, and again, I know we're gonna go into this more, but there's been news around HG and that they've found the cure and it's linked to this gene.
Yeah.
And you know, I'm having conversations with women of like, it's great to know that that gene is linked. How do you eat or live or operate around that gene now to make it function optimally? And it's just a blank face, right? Like the genes itself aren't necessarily the issues. It's how do you want to live your life according to those now? You know, if you do have poor MTHFR function, what are you doing in your diet and your lifestyle to compensate so that you can help that work as optimally as possible? And we're not taught that at all anywhere.
Yes. And you gave me a lot, so I'm going to process and see how I want to follow up. I have a sequitur that I'm going to get into based on what you're talking about, having this ideal of maybe who you are or who you ought to be, and then also just acknowledging who you are and the strengths that that can lead to, even if it's different than who you think you ought to be. But I love, you know, talking about, and we'll get into genetics and we'll talk about a little more. I'd love to hear kind of, you know, whatever you want to share for HG specifically, what you think it's helpful for women to focus on. But I get a lot of women that ask me about, you know, testing for MTHFR and all of these things. And typically what I say is, I don't really care about the testing because, and this is my understanding of Ben Lynch's opinion in certain contexts, because unless you are building a lifestyle that's going to support healthy epigenetic expression, like it doesn't actually matter what your genes are saying, if the message can't be read or the message you don't have the building blocks to read the message or create, like do what they're telling your body to do. So I think a lot of people don't actually, like, you may have dirty genes, you may not. But really at the end of the day, we all need that healthy genetic lifestyle. Otherwise, we're not going to be able to function at our optimum capacity. So I think I have, and I'll feel free if you want to respond. And then I have a
Yeah, I
follow-up
have one little
question.
quick story that's like that fits into that might just tie it together really well. Is, you know, sometimes I've given support for people who are in hospital because it's hard to navigate and they want some advocacy and stuff like that. And you know, I had a friend who was in hospital and she had all these symptoms and they were going to do a test for MS for her. And she was like, it doesn't matter what I have. I know as soon as I get out of here, I'm going on like an autoimmune diet. I'm going to change this about my lifestyle because it doesn't matter which one it is. Like, these are the changes that I know I need to make intuitively, and I'm going to do it. She's like, but I might just do the test. And so I kind of prompted of like, okay, so you can do the test, and it's not a financial issue in our healthcare system for you to run that test, but you know, in the States it might be. So A, do you have the finances to do it? But B, is it worth the risk factors? You know, you're going to get a spinal tap? Is it worth that just to know if you're going to go home and make all the exact same lifestyle changes anyways? You know, does it tick a lot of boxes? Are those risks worth just knowing the answer, right? And so it's the same with the MTHFR stuff. And I get people asking as well, like, if you want to go pay hundreds of dollars to get this test, that's fine. That answer is going to give you nothing if you don't do the lifestyle things to support it. Or if you're determined that this feels kind of like aligned for you, why don't you just take those lifestyle changes now and save yourself the money?
And then too, if we get something labeled, and that can get to, you know, then we start to let it define us in a sense. And I think I think there's arguments on both sides. And I see a lot of my clients are neurodivergent. And I see some of the benefits of like, oh, this is like a label that explains me, or like, okay, this is why my brain's working in a different way. Kind of you were talking about with human design, when you got that label that helped you categorize your experience and process it better. But what I often see, you know, the flip side of that is, depending on the mindset or the approach you have to it, if you think, oh, if I get an MS diagnosis or if I get an MTHFR diagnosis, like that, I'm the victim to that. There's nothing I can do about that. I just have to, you know, take a drug that will hopefully save me indefinitely, or whatever the response may be. That's typically sometimes right. I don't want to say it doesn't matter, but I think people get
a little bit too caught up in that, or they just pursue the wrong thing. We're constantly finding tests and all these things. Like, I want to label what is wrong. In my book, like, we know something's wrong. Everyone's got something wrong. Let's just focus on the solutions, because the solutions take time and money and effort, and you want to just prioritize where you're devoting those resources. So I love, that was a really great anecdote. And so I think my follow-up question, I'm kind of getting back to our conversation, somewhat got led into just understanding that we all might have certain, I guess, weaknesses or differences that we bring to the table, and it's helpful to acknowledge those. And this is something in my free training series that I offer. I have this motherhood mastery framework is something I call it, but I talk about, there's this aspect of that framework, which is the physical means that we bring to mothering. Now, and I hope you're okay with me asking this question, but I'd love to hear, because I was in not the same position, but a similar position. I'd just love to hear your experience of what is it like to begin a motherhood journey and be in a position where you feel like you're not bringing the physical means that you were hoping to bring to that experience. Does that make sense? And I'm going to kind of open that door for maybe if you want to share about what your HD experience was like for you specifically.
Yeah, so I think, there's the pregnancy phase of that, and then there's the, postpartum phase of that the question can really be answered in two things. And in the beginning, in the pregnancy aspect, hindsight's 2020, right? And you don't necessarily know what you don't know. So for the first few months and really battling with that and just living in a state of being debilitated by my HG, it's an interesting portal of time almost, if you will, because you're not really being picked up by a healthcare provider, whether it be a midwife or an OB, till around 12 to 14 weeks. Oh. And so you're really in this window of your peak amount of symptoms with no guidance on, is this normal? Is this morning sickness? Is this more than morning sickness? I'm not really sure. So that kind of became like a tricky part. But I guess if we go fast forward, because I think this will lend itself more to the audience of like being now where I'm at. Mm-hmm. And if I can shed any like hindsight, or like I said, like the hindsight's 2020, like into women who are in your world or in my world, could I go back and change a million things now if I had prepared preconception? Absolutely. Mm-hmm. Right? Could I have made it an easier time for my little one, just in things that I feel I passed down to him or difficulties? Absolutely. Like, so it's a tricky situation, because you can't take on guilt for things that you didn't know about. But certainly if it crosses your path, you'd be wise to take advantage of programs like and people like you and I who are trying to educate and trying to help, because it is going to absolutely change the foundation. For me, knowing what I know now and just what I've learned even through the last 2 years, maybe my baby's 18 months, but obviously while I was pregnant, just even more in depth on understanding the liver detox pathways and what nutrients are needed to support that, I would totally have changed my focus of my nutrient building blocks in those first 3 months and what I was really getting in, and how I personally do believe that would have changed the effect. Like, my little guy had a tongue tie, and I know he has MTHFR issues, and there was tension issues. And so I'm, doing body work on him now. I'm doing chiropractic. I'm supporting him with folate. I'm trying to get supplements through my breast milk for him, and if I had done this work earlier, it definitely would have potentially changed the trajectory. And it's, once you know better, you do better. So I think that, if there's ever a point of me having another, it would be a totally different story on what I prepare for. And if there's anyone in our audience that's thinking about it, I see this with a lot of moms, and I'm in some HG communities, and it's almost like, okay, I'm pregnant now. What do I do? What medication? What's the list I need to get on? They're asking all these other moms who are in this HG support group, like, what are the 10 things I need to do, and at what dosage and how much, and and just getting feedback from everyone else. I'm like, you wouldn't have to do any of this if you did some of the planning and the preparation, or if you understood your body. At a minimum, if you understood your body, you'd be able to just change even some diet things that would take out your need for medications and things that we don't know the long-term effects of. So yeah, if that answers things.
No, yes, and I'll maybe probe you a little bit deeper because we'll see if we'll get to it. But I agree, like in the sense that I had not this, you know, there was things that were missed with my first child that, and it was actually an oral tie as well when that didn't get diagnosed, which, and the caveat I'll say is I feel like I did a really great job of preparing for pregnancy with my second. He still had oral ties. Maybe like it's from my husband's side of the family. So I'm like, if we do it again, I'm like, maybe we'll work on you a little more. We'll see. Like, it's never about, and I think it's never about, let's say we're someone who's currently pregnant and maybe they have HG right now and you're really suffering and you're listening to this. It's not about feeling guilt about what you've done. It's just understanding the tools that are available. And I think all of these conversations, that's always my goal. And you can't share the tools of preconception if you're completely afraid of ever telling some mom, oh, there was an opportunity that you potentially missed. Right. So, but to continue that conversation, just there's challenges that are in pregnancy, but I think you're kind of alluded to that as well. They often like small things in the beginning, which I'm not saying HG is a small thing, but there can be small things that they just like it keeps getting bigger because you have like an imbalance that leads to something in your child, and it can be something that as simple as, an undiagnosed oral tie that could have been revised and, given body work and all those things and just set them on a better path when they're little. If you don't find out about it until they're 3 years old, then you've lived through 3 years of either nursing challenges or sleep challenges, like a baby that can only sleep an hour and a half at a time, and then the impact that has on you and your stress levels. And these are things my goal is to just not all women are going to be in the position to always act in foresight. I work with sometimes you have to live the hard experience once to realize, okay, I need to take things more seriously. But whatever position you're in, I think it's important to share stories, especially like yours, where you've been through the hard thing, but you realize there was a solution and things could be better. And so I just want women to know, okay, what is this hard thing that you went through? And then what was the solution? So that would be my follow-up question. If you want to kind of just share, like what HG felt like for you, you don't have to, but just like, what was your position? Like what medical care were you offered? You mentioned being in that limbo zone. And then how are you able to move past your HG? And then what did that look like going forward? And maybe how could you imagine your story having been different, your motherhood journey? What could have been different had you not found those solutions to your HG?
Yeah, so that's going to be a big one. So I think for me, kind of my experience with HG, I'll just touch on that a little bit to kind of give the context. And so it started off, I knew I was pregnant very quickly. I got out of the shower and I was exhausted from standing in the shower and I had to lay down. And I was like, oh, this is not like me. And my husband's like, you're not seeming like yourself. I don't know if you're lazy or if you're mad at me or what's going on. And it just clicked. I'm like, I need to take a pregnancy test. And it was very early, I would say that I had maybe like 4 or 5 days between my, I think I was days within my cycle of knowing I was pregnant. So it might have been that I was, 2 weeks pregnant before my symptoms started kicking in. And it became at first just being sick in the morning, sick a few times. And then it, as the hormones peaked, as different things changed, again, hindsight, but it started to be that I would throw up. Typically an average day for me would be 5 to 10 times in a day. On bad days that I would classify it was probably 20 or 30 times in that day. And it meant that I couldn't even put a sip of water in my mouth. So I was sitting there in this state. I don't know if many of you have probably experienced this, of when you have a flu and you're going to be sick, and it's that 5 minutes before you're going to be sick and you're like, do I just go to the bathroom because I know it's coming, but I want to hold off, and maybe if I'm just totally still, I could fight it and it won't happen. It's like living in that state permanently. And so knowing that you need to get in food, knowing that you need to get in water and you need to nourish and hydrate for this baby, but every bit that you do that is going to mean you're going to purge more than you're taking in, and the mental struggle and battle with that. So, you know, I've been someone who's been really lucky to have perspective on difficult times where I know it's a phase and it's a difficult time, but I do want to acknowledge that many women think of suicide or termination of their pregnancy in this state, because it is, you know, I remember counting day by day and going, okay, like I'm at 18 weeks and I have 22 more to go. Like I have more than half of my pregnancy still to go, and I haven't been able to move for 7 hours today. How do I do it? You know? So it was just a totally debilitating thing. And then the medical system isn't built to support it, and it's not intentional, but they don't understand what it is. They don't understand, you know, especially many times you have men telling you that like, oh, it's just morning sickness. And you're like, okay, you've never been pregnant. You've never had any of these issues. So for me, you know, the first 2 times I went in to get IV fluids on really bad days, it was taken quite seriously and it went through quite quickly, and they got me on IVs and offered me medications. And, you know, I felt better enough with the IVs, and I said, no, I don't really want to. I think on my 3rd visit, they were, you know, saying like, oh, have you not filed the prescription? Have you not gotten it yet? Like, I don't understand why not. And I said, well, you don't test these medications during pregnancy. And again, a male doctor is kind of looking at me and he's like, yeah, you're right. And I understand that, you know, we've made some errors, particularly with x-rays and with thalidomide and different things, but we think this is okay. We think we've got enough research. And I'm like, I'm not really feeling like putting myself in that I think category.
Yeah.
So in terms of the support that I had, it wasn't much. You know, the doctors were kind of looking at me like I was foolish for not taking the medication that they prescribed, which was chemotherapy medication for the nausea that you would get while you were doing chemotherapy. My midwives really weren't, you know, I really wanted to have a fully natural pregnancy and a fully natural home birth, and I just didn't want any of it. And it felt like I was always being met with people that are like, yeah, well, this is what we do normally. Why don't you do it? All these other women do it this way. And it was against my intuition. So in that sense, I kind of felt isolated in making my decisions and in how I navigated it. And it was almost like, am I going to go to the hospital just to be told I'm an idiot again, sort of thing. So I consulted with other people, you know, I called naturopaths to see like, can I come in for IV infusions all the time? And like, will that help? And it was just the feedback I got was kind of, you're risking dehydration of the amniotic fluid so much that you're going to put the baby at risk. So if the medication stops that, then you can get food and drink in, that's going to be your best bet. So I started on one of the medications, diclectin. They also prescribed me another one, which they gave me when I was in the hospital, but I didn't take any other time. And I only did a half dose, and it curbed it enough for me. It gave me like a little window of an opportunity to feel good enough to even think about anything. And so for that really came with divine timing of seeing a comment on an Instagram post from Dr. Ben Lynch about how HG is a histamine intolerance reaction from your body. And so as soon as that kind of comment struck me, I'm like, I'm on a medication that's helping, and it's an antihistamine. Yeah. Right. And so those 2 things went like ding, ding. Yeah. And I said, ooh, like there's something I can do here. So my mindset, you know, how I was trained in physiotherapy is anytime you have a problem, develop a list and put all the causes of that potential causes of that list there. And then like, what can you do to cross some of those off? And so for me, if the medication that was working was a combination of B6 and an antihistamine, one of those 2 things was positively impacting me. Was I deficient in B6, or did I have too much histamine in my body? And so that gave me at least a little bit of inspiration to just like do what I do normally, but couldn't while I was sick. And that was just dig into everything. So I had previously read Dirty Genes. I like ran down to my bookshelf. I grabbed it. I cracked it open. I read everything again, specifically on like MTHFR, DAO, histamine metabolism, all of these things. And I thought like, oh, well, an easy no-brainer thing is to just cut out histamine foods in my diet. And that gave me another sort of light bulb moment in this of when I looked back on all the days I was hospitalized, it followed days where I was out and doing something. I chalked it up at the time to being, because I was sick over Christmas, right? So I chalked it up to, you know, I was just overtired. I extended myself. I went out for 3 hours. Oh my God, that was crazy. Why did you do that? And really what it was is I was nibbling on foods that were high histamine, and it was causing me to have a histamine reaction. And that came in the form of a purge, you know, in sickness. So when I look back, I go, oh, like I had cheese or deli meats or like, you know, all those charcuterie type holiday spreads that you would normally have. And so all these pieces started to kind of just light up for me. I reached out to Dr. Ben Lynch. I'm an affiliate for some of his stuff now. And, you know, I just said, like, this is where I'm at. What do you suggest? He gave me 2 supplements, you know, increase your protein and take the prenatal powder, take the probiotic that deals specifically with histamine. And then in my own time, I also already had, there's a Canadian company that makes beef liver, and they have beef liver, heart, and kidney. And on the jars, I noticed on the kidney, it said can help with like histamine and allergies and all this stuff.
Yeah.
And so I went like, oh my God. So I started taking beef kidney. So I started taking beef kidney every day, and it was like a night and day difference. So once I supported, you know, I'm a believer of like organ heals a like organ. So obviously my kidneys were taxed, and that was affecting my whole ability to detoxify as well. So the initial things, again, if I'm going back to my story of like, what cards do I have in my hand to play here? It was an immediate antihistamine diet. It was supporting histamine metabolism in my body. It was resting and increasing my hydration for my kidneys with mineral rich water. And it was just this slow kind of pulling in anything that I found in my reading and in my research. And once I implemented those changes, I think I implemented them within 2 or 3 days of kind of making this master plan. I threw up once, either on day 2 or day 3, I'd say post HG healing plan, and I never threw up again. I went on to like be just glowing and radiant. I went on to tell my midwives about how I like cured my HG, and they just rolled their eyes and didn't care. You know, same with sort of some of the medical professionals that I passed along the rest of my pregnancy. And yeah, I guess it was just this feeling of taking back my power, which really set me up for taking back my power in the birth that I wanted to have. And in the postpartum I wanted to have. Again, you know, I touched on it before, but we're always told that other people have the power or other people have the knowledge. And I just don't believe that's true for a human. You just grew inside of your body with your own cells, and you live and breathe beside every single day. So I think that that's kind of my HG story, kind of my pivot point. And I guess had I not come across that information, I don't know. I mean, I was about 23 or 24 weeks, I think, when I kind of like did the shift. I don't know. I was past the point of likely miscarrying, but I don't know if I would have. Certainly, I think I would not have had the birth that I wanted. I would not have had the ability to stand in my own intuition the same way. And I think, you know, post-birth, the health profile of my child would have been much different had I continued on. Because how could it not? You know, how am I getting any level of nutrition for this baby at that level of debilitating nausea and vomiting?
And even I just love if anyone's listening, right? And you are either in that position or were in that position in maybe a previous pregnancy, and the fear of repeating that experience, which is completely valid, is maybe stopping you from even, you know, considering another child that you maybe really desire. I just want to share this story of hope that Jess has. And often just what's heartbreaking for me, because I see this not just with, you know, pregnancy nausea, but a variety of things. How simple was that solution?
Yeah.
Right, Jess? I mean, like, and because you could have started that had you had that knowledge. I mean, you could have started that right away. You know, if your doctor had been educated, because it's not that big of a leap, because the sorry, I'm going to say it wrong, but deoxycycline, the B6 and antihistamine, I think I said it properly. That's the brand, but that's like it's over the counter here. Like that's the classic, oh, you have morning sickness, take this. It is B6 and, you know, over the counter antihistamine. That's like the one, you know, standard treatment for morning sickness. And, you know, with those medications, there's more unknowns. It's better to use, it's like, oh, well, I could take that medication, or I could just understand, oh, what are high histamine foods? Or oh, maybe I have an overgrowth of histamine producing bacteria in my gut, or all those other supports that you mentioned. And why can't providers acknowledge like that is what they're prescribing is B6, which helps upregulate progesterone, DAO enzyme. Like you need B6 to create the enzyme that breaks down histamine. And then they're giving you an antihistamine and it helps women with morning sickness feel better. And yet it's like, as you said, you like bring this knowledge, you're like, hey, this is actually what's happening. It's very like the physiology is very clear. And I'll get, because a lot of these common pregnancy issues, like it's very clear physiology, and yet they treat it like it's a black box. We have no idea why that's happening. It's just a normal pregnancy symptom because pregnancy should be inherently painful and that really just comes from this idea that women are bad and deserve suffering. Like, I really think that's ingrained in our society. And that's something that I know I embodied that mentality. I didn't think I did, but I embodied that mentality during my first pregnancy. And that led to my suffering, because if you have that belief that you are bad, or that you still have that belief lingering from 10th grade gym class that like if you have sex and get pregnant, like you're bad, right? Even if you're, happily married and like in the place where you're supposed to be getting pregnant, that belief lingers. And that leads to us accepting like, oh, well, I don't feel well. I guess that's just, normal. So took it a bit far, but it just frustrates me so deeply, because as you mentioned, I mean, women with HD, they consider suicide or they terminate their baby. And I mean, you could understand why. I have not been in an HD position, but I've had that experience you've described with having the flu and like, it is awful. And I'm just like, every time I get through that, I'm like, thank God that was only, a few hours. And I can't imagine. I know women are incredible. I mean, we're strong. We can get through a lot, but it's better if we don't have to. It's better. And also some women can't. Some women don't have that capacity. I mean, women we all have a limited capacity for suffering.
Like to just bring one little piece up, and this would be a totally different conversation, maybe for another time. So we will spare that, because the amount of things that we're touching that we see, the same thing goes into the labor and delivery aspect.
Yes.
But one thing that I will say, and I was grateful to have like a really like-minded doula, and she taught me about, and I mean, I have 10 years of anatomy, so I understand it. It's just those moments where it clicks, and like you make the process in your head, you see the map and you're like, okay, great. I understand it now. And so we're always told about everything we see with pregnancy is a woman lying on her back, screaming at the top of her lungs in the worst pain she's ever experienced. And that's what we think labor and delivery are, right? Or birth. And so even just in that process, I just want to touch on the fact that we're not educated. And so we can't make truly, I don't want to say like informed decisions, but it is like that period of peak, labor and delivery experience is transition, and transition can be 5 minutes till usually a max an hour. And so if a woman knew that you are in the thick of things right now, and it's probably going to end in 10 or 15 minutes, can you cope with that? They go, oh, okay, yes, maybe I don't need the epidural. Maybe I don't need, the next step, because you understand, it's only this big of a time. Do you think that's manageable for you? Versus the mindset of, oh my God, this is horrible. Am I going to be doing this for 50 hours? Because I can't do this for 50 hours. It's the same thing with the morning sickness, right? Of like, if you knew, and if you could see that this is a window and this is how you get past that window, would your decision making be different than if you think that like this is all there ever is, right? And so in termination and in abortion, and when those things come up for HG women, it's because they can't imagine living that state for that, like for a huge extended period, like indefinitely, And so I think that as women, like we have been done a disservice, and we continue to, if we want to take true accountability, do a disservice to ourselves when we don't take the time to understand our bodies, our basic physiology, or different things. And granted, we don't always know that information is available to us. But again, when it comes to pregnancy, when it comes to this, like it is going to be life-changing to know these things, and it's going to be like mindset changing, and it's going to be, you know, just a whole different story when you get the actual better understanding of the picture in front of you rather than just walking into it blindly.
I love that. And I'm gonna pull like the flip side of that because I love you're like, okay, if you know whatever intense experience it may be, right? It is a lot. I describe this, I say like giving birth, comparing that to getting my wisdom teeth out and like post that recovery. I would rather give birth. Like I'd rather have a baby. And people like I think I had a particularly bad wisdom teeth experience. I mean, I took Oxy afterwards because I was in so much pain. And it was the sense of like, I don't know when this is going to end. Whereas neither of my children did I take any form of pain medication during labor. And it's because were there sensations that were more intense during the labor process? Probably, but I knew it would end. All right. I knew it. It's like, this is not going to be, I mean, worst case, you know, like whatever happens during your birth, like it will end. It cannot last for more than, you know, I don't know, but you know, like a really intense labor, like the longest labor, like maybe 48 hours. You know, you can have early labor go longer. But which I think is helpful. Like that was definitely key for me in terms of birth, but to bring it back also to pregnancy, the other thing that I see is kind of the flip side of that, which is where, because in a sense, we know pregnancy discomforts are self-limiting, nobody bothers to figure out how to support them. That's what I ran into. So when I had my gallbladder, I had ICP with my first pregnancy. I never got that diagnosed, but in retrospect, I should have, because that diet, and we'll get back to, but like when if that diagnosis means that you're not a healthy pregnancy and you should be risked out of something like an out of hospital birth, that's something you want to know, right? When we talked about diagnoses earlier, but when my like I couldn't digest fats anymore, and I think it was a combination of sluggish bile, and then I was just really mineral deficient, and so just when my gallbladder needed to contract, when that was harder, if you're it's like why we get menstrual cramps, a lot of things, why labor can be more painful if we're mineral deficient, why you get a Charlie horse in your leg, if you're over exercising and dehydrated, and they give you bananas for the potassium, that's what makes muscle contractions more painful. But anyway, when I was dealing with that, and it was to the point where I could not eat any fat because it would lead to, I'd be in severe pain I'd have a gallbladder attack for the next several hours. There were solutions, honestly, pretty simple solutions. And what was at that time, it was like, okay, well, fat causes pain. I'll just cut out fat. And it was just the sense of like, there's no reason to fix this problem because it's just due to pregnancy and you're already 25, 30 weeks. So you just have to wait 10 more weeks, and like, you can wait anything out for 10 more weeks. Like why bother to figure out that problem? Mm-hmm. And I just think that women deserve so much better. Like, I don't really care. Yeah, sure. The pain of pregnancy, if we're having discomforts that are symptoms that are aggravated by pregnancy, sure, they may be self-limited, they may go away, but they're a sign of a deeper issue. And ideally, we can identify and support that issue before pregnancy, so you're not exposing a whole and brand new, tiny little, perfect, just beautiful person, right, to that imbalance. Like we can really address it and protect them from that. But even if you are already pregnant, I just think you deserve to feel well and to thrive during pregnancy. And I think that God designed motherhood and birth and just having the gift of bringing forth the fruit of new life. And like, that's part of the gift of woman and our role. And I think it's a beautiful thing. And I think it was designed to be a blessing. And I think birth, when it's not that way, it's because of how broken our world is. And that brokenness shows up in, right, because our soils are depleted, or it shows up in so many things, but that's why we're malnourished. And that's why our genes do not function the way that they were designed to function, which was perfectly and optimally. But I think I'm just like, we're talking like the two sides of the same coin. It's like, yes, you can get through things when you know there's an end in sight. It's easier to endure. But then there is also what I see that leading to in pregnancy is just a complete lack of support. And this was a big thing. I mean, I have what I describe as my pain-free pregnancy protocol, which I developed during my second pregnancy. And really what that was me saying, okay, what if I approach pregnancy with the belief that it should not be painful at any point, right? I should not be like, I should feel amazing. I should feel really good. I should not be getting bloated. I should not have digestive discomfort. I should not have pelvic discomfort. My back shouldn't hurt. Like, those are all signs that something is wrong and my body is asking for support. And that is my job to use the best, use my brain that I've been given, use knowledge that's available, use other practitioners that have education and skills to go out and seek them and give my body the support that it's asking for. And like, what would happen if I did that? And what happened was I had a pain-free pregnancy. It's not like I never had a moment, but if I didn't have any chronic issues. I was comfortable. I could walk, I could move, I could eat all the, like, any kind of food I wanted throughout my entire pregnancy. Obviously, I chose healthy food, but I didn't have to eliminate whole macronutrient groups or felt like I could only eat a small amount. Like, I could eat to full satiety, which if you've ever been, I haven't been in an HG context, but I was that third trimester, like, you are starving, even though I could eat food. If you completely cut out fat, like, I was starving, even though I was eating, but like, I was starved for nutrients, and it's miserable. I mean, starving is just, it's not a position, you're starving. And then your body's just like giving all that it can to baby, because it does prioritize baby. And I think that's a beautiful thing. It's not perfect, right? We tell women a lot in the first trimester, oh, it doesn't matter. Baby's really tiny. They have tiny nutrient needs. No, it does have impacts, which I think we tell women that because we don't want to make them feel bad. Like, if you're in the position, like, you're throwing up, you're like, I know I should be eating, like, I'm trying my best. It doesn't necessarily, you don't be like, well, anyway, the point I'm making is we shouldn't just talk down to women and tell them things that aren't true to make them feel better. So I've kind of gone in too many different directions. So I will bring it back. But I just thank you so much for sharing your story. And I'm so happy we connected, because I have a lot of women that reach out to me either because they are really suffering with morning sickness currently, or they've had past pregnancies with morning sickness. And I've supported several in my programs. I have a lot of tools and protocols for morning sickness, and there's a few different causes that we address. Histamine's one of them. There's some drainage causes. I actually have a video on my YouTube channel. The name I'm escaping me, but it's the real cause of morning sickness, I believe. And I talk about the phases of liver detoxification, especially phase 3, that bile drainage pathway, and how important that is. But I didn't have someone to go to that had that HG experience. And I didn't have someone I knew that has, I guess, the proof of how HG could be overcome. I knew theoretically, and I had helped, kind of milder cases. I think one of my very first coaching clients, or nutritional therapy clients, right back when I started, she was around 20 weeks pregnant, and she found me, and she was like, yeah, I used to throw up, like, my morning sickness was pretty bad. I think my OB said, I think it's maybe could be HG, which really, I gotta refocus. But she's like, but now it's okay, right? Because I only throw up like at the end of the day after dinner. So like, I'm doing okay. And I just hearing that, I'm like, we shouldn't, like, you don't need to be throwing up at all to be pregnant. Like, I've had, so it's not normal to throw up when you're pregnant. I have a quote I want to read, but I'm going to bring it back because I've gotten all over the place. I'm just so thankful that we connected, Jess. Like, when I saw one of your reels, I was like, oh, yes. Like, because I wanted to have another resource to direct women to, just to have like a story that just gives proof to the physiology I knew to be true. And your story really does that. And I don't know if you've have other clients that you've worked with that have seen similar results. I'm assuming so, but so feel free to share if you have some other stories that could give hope to women that are listening.
Yeah, so I think I was given the proof that I need when I talk about this online, right? As soon as I would talk about it, I would have 30, 40 DMs.
Yeah.
Anytime I talk about it, it's everyone who's in my world going like, oh my God, so wait, you can fix it? Like how? Or what do you do? Or, how can I do it? And it's the reason your doctor doesn't have an answer for why this is because it's not a single factor. It's not just
Yes.
one thing going on in your body, it's a combination. And so over the course of like talking to women and having this conversation and doing my own research, I'm like, I need somewhere to put this. So I did create a course to kind of do this, to be a self-guided thing, because it's labor and time intensive for both me and that other mom. I was coaching women on a one-to-one call and just getting some ideas, and they go, okay, try this. And then they message me a week later and be like, okay, and should I try this? And I don't want to just tell you to do something and have you do it and not understand why. So I wanted to develop something that really got to the bottom of it in just understanding that. So I kind of broke it down into like the 5 main causes, although that's extrapolated into 7 already. But really like what environmental toxins are a burden to your system, and what can you like eliminate from there? And like, how do you even know that that's applicable to you? So what I wanted to develop was a self-assessment tool so that you could go through, and that's kind of how I've laid it out, of like, okay, let's look at environmental toxins. I talk them through it. I kind of give context and education, and then I give like a resource, a questionnaire. And if you score a certain thing, then it could be possible for you. It could not be. And like, then what do you do if you're preconception or already pregnant, sort of thing? Because the difference, if you're living in a moldy house, the difference of mold detoxification efforts that you're going to do when you're pregnant versus when you're preconception are totally different, right? You are not going to go into a heavy mold detox mid-pregnancy, not happening. But you could add plants. You could maybe rent somewhere else for a little while. You could open the windows every day. There's our strategies, so breaking it down into what things are really factors, those external toxins, those internal toxins, those bacterial overgrowth, those parasites, different things that you maybe not are aware of. H. pylori is highly linked. So what bacterial imbalances, internal toxins, and just things are you not able to detoxify out from inside and outside, that is contributing to a backup of that liver detox? And it's my belief that your body is making you sick to purge toxins to protect the baby. Smart, right? And whether that's purge just toxins or whether that's toxic material, so it's estrogen that's built up, or something else, your body is trying to either purge the toxins or create a balance of electrolytes and of minerals that you are deficient in. So it's kind of one of those two things. We get into the nutrient aspect, and obviously you need these nutrients to go through the liver detoxification. And so what does your diet look like? Is it likely that you're getting them? And if you are or aren't, then what do? If you're taking a supplement, are you taking the optimal forms? Because let's just assume that you have an MTHFR issue and you want to be mindful of what forms you're getting in, or you could be creating, hidden deficiencies in the background. Talk about genetics and the fact that yes, genetics definitely play a role, particularly your MTHFR and your DAO gene, but how can you support those and really minimize that down to the 5% implication that it could, at best case scenario, right? So really going through all of these things, understanding and recognizing that you likely had a lot of these things prior to pregnancy. You didn't just stumble into pregnancy and all of a sudden have estrogen dominance yesterday, and now it's an issue today. It's been something that's been going on. And so in that category, maybe, what do your periods look like? My questionnaire goes through like, what is a normal cycle for you? What symptoms do you have? Do you know when you're ovulating based on your mood and changes like that? Do you have migraines or headaches or issues around heavy clotting or different things? Because if these things were applicable to you now, they're probably playing a factor in what you're going through with HG. And once you have this kind of broad picture of, okay, I think this thing and this thing and this thing are all, affecting me personally, I like to say it's like your personalized cocktail, right? Like it's your own cocktail. And I can't just give you one thing or one answer that's going to solve that. You need to understand the ingredients of that and like, what are you going to do with them, sort of thing. So yeah, I think that just to tie it in something that you said before of like understanding that we don't have to suffer through these things is we like the medications that they might be offered. Well, that's great because it takes away your symptoms. It does nothing to change all of those factors. It does nothing to change that you're living in a moldy house, or that you're deficient in nutrients that are needed for detoxification, or that you're way imbalanced in your hormones and your body's not able to excrete those out because you got like sludgy bile and nothing's moving through there. Like that does nothing. And all of those things have implications on the baby behind the scenes. So yeah, I think that it's just really important work, the things that you do and I do. And I see, like, you know, there's moms who say like, when one pregnancy was okay and they've kind of gotten worse each time. And now I wanted to have 4, but I don't want to have my 4th. And I'm like, okay, when they're getting worse, like your nutrition deficiencies are getting worse. Like that's probably a big sign here. So it's, I think what we both do is really try to educate women on like, these are the ways your body's communicating with you. And if you listen, it's not that hard to like hear what it's saying. Right. And the changes and like what it needs is not that complicated. You know, it's not, we're houseplants. We need sunlight. We need high quality water. We need nutrient dense food. We need good community and energy around us. And we don't need to live in like a toxic garbage environment. It's not super complicated. And if you can tweak a few of those things, many of which are free, you can really have a big impact on how your pregnancy plays out, how your postpartum journey plays out, how your life plays out.
I couldn't have said it better myself, Jess. I really could not. And I think what irks me, and it's so much easier, right? You're like, okay, it can be a lot of things. And women, sometimes women get to a program, sometimes like mine or yours, are like, they get really overwhelmed. And that's one benefit to doing some preconception work, because pregnancy, honestly, even in the best, there's just a lot. Like if in a nice, you can kind of just rest and enjoy, but if you stumble into pregnancy and it's just, you're trying to figure out everything, the risk for overwhelm is really high. But it is so much easier to feel well than to feel unwell. I mean, like, how hard is it to not be able to get out of bed for months? Or if you had an older child, like arrange childcare for months, or miss work for months, or I mean, there's such, and I don't say these things to be like, oh, to scare people or threaten, because like there's enough of that, but it's just understanding like that is the reality that a lot of women face during pregnancy. And there's not that great of tools available to them in the standard medical model. And so it just, having the encouragement to avail yourself of the tools that are available, you know, in a program like yours or a program like mine, in the Baby Ready Body. It's just, I just want women to see and just encourage women to equip themselves and empower themselves. Yeah.
Yeah, I see that too. And you know, the women that have been going through my program that I've created are seeing more or less the exact same results that I have, you know. And there's a handful of people that I have right now that are like in the preconception. Most of the people that have come through have been like pregnant, and I'm like, okay, I want to know if these things ahead of time like really help too. And because this program is only like less than 6 months old that I've created, but it's just like, it's hard to say that like if someone's like, give me the one supplement you would do,
No,
I'm
no,
like,
no.
I can't really, because I
No.
don't know what's applicable to you.
No.
I can tell you that there's a high chance that A, B, or C are involved, but really it is like, this is a journey for you to embark on, and it's like going to set you up for success, and it's going to give you clarity and just really change the trajectory of things. So I don't know, it is hard to say. Like, I mean, you have testimonials of your women, I have them of mine, and I want to just like tell every woman that it's possible. The exact one thing that's going to make it possible, I can't give you over an Instagram reel, you know what I mean? But I can give you that reassurance that you are going to understand, and you're going to have a whole list of tools that are not complicated. Again, like you said, the capacity for overwhelm is very high here, but it is broken down into really small, manageable pieces. You know, do you feel like you had bad periods? If so, your estrogen is high. And if that's high, it's driving up your histamine, and that could be why you're sick. Here's what you're going to do, right? It's like, really, when you peel it back, it is an easy process, and it's just about pairing that education with your own intuition and what like kind of pings you're getting internally, and just going through the process. So I think that's a message that I would like to share on your behalf and on mine, that if you are somebody who wants better, then it's available for you. And it's going to be harder, it's going to be complicated, but you get to choose your hard. For me, choosing to eat less kombucha and sauerkraut and pickles was way easier than choosing to puke 20 times a day for the next 20 weeks. So it's a simple decision, but it's we don't know it's there until we take the step to like invest in that, or to money, but mostly time, and mostly like our mindset, right? Like, do you have the mindset of like, there's tools available to you, they'll make life better for you, do you want to access that?
Yeah, I love it. You're taking the words out of my mouth yet again, Jess. We're gonna kind of come to a close here. I just wanted to bring like, I see mold is part of my history too, and like my mold toxicity, big thing. I had that ballooned into, it played a big part of my, I don't like to call it my painful pregnancy, but my challenging first pregnancy, and like kidney issues and things that lingered with me postpartum. So getting back to the like, oh, well, you can wait it out, but or you could take the medication, the nausea goes away, but there's these issues that there's underlying imbalances that are leading to these more pronounced symptoms during pregnancy. And you're going to still be in that body after baby's here, and you've got the rest of your motherhood and life to live in that body. And typically those imbalances have gotten aggravated if you're going through pregnancy in a super depleted, unsupported state. But what I was trying to get to, and I think I'll come back to it, I call it the like Kate Middleton syndrome with HG. And it's this kind of like profile of mold exposure, low body weight, like low body fat percentage, potentially like type A personality, and like just like very like kind of high
Like
strung.
me, yes.
You honestly, like you look a bit like Kate Middleton. Like I could put you in, but because I know she's like, if you think of the most, I don't know, perhaps most famous HG person, I would think of Kate. That's who comes to mind. I don't know if that came to mind for you, but I know she was hospitalized for all 3 pregnancies with HG. But that's just a pattern that I see, and it makes, mold and the impact on your bile pathway, and it also increases estrogen. But it's just one of those things, like if like the queen of, soon to be like someday queen of England, right? Like can't even have that problem supported for her, like how broken is our system?
Yeah.
Like, because you would think she would get the absolute best possible care, and yet she still like really severely suffered and was hospitalized multiple times through 3 pregnancies. Right. But the like
I think there's such a big, we cannot go down this rabbit hole or be here for 5 hours, but it's a big like light being shined on the systemic problems that we have in healthcare, right? And again, I don't think that any one doctor doesn't know this stuff because they're out to get women, or any one nurse doesn't know these things. They're trained under an education system that profits off of being sick and runs on pharmaceuticals. And so the idea there is that like they are the specialist of disease management. They're not the specialist of healthcare or optimizing wellness, right? And so we see this entire system that we put our whole body and our whole profile into trusting, and it's what it's good at is disease management and death prevention or death prolonging, right? You're not saving lives, and this is, not to shit on them, but you're not saving lives, you're just prolonging death, right? And I want to like make the experience more rich in life and in wellness, and like enhance that. Like that's what I think you and I do. And it can be easy for somebody to come at me. I had someone last HG reel I posted, and they're like, I'm sorry, like who are you to talk about this, and do you have any medical certifications and blah blah blah. I'm like, well, I have 4 degrees and diplomas, and I've been doing this for 15 years, but I guess I don't know. Like you tell me, internet trolls, right? And it's like we've just got to open up our mindset to the people who have lived this experience. You know, I'm just starting a podcast and I've just talked of, like, in my first 2 episodes, of the idea of like clinical expertise versus evidence-based. Like, do you want evidence-based where these doctors are going off information that's 17 years old and hasn't made its way into hospital policy because it doesn't profit them? Or do you want the person like you or I, who are working with women every single day, who are saying, this is what I'm seeing, you know, what's more valuable to you? And of course there's pros and cons for both, and there's biases in both, but we need to be open to the fact that there are people like you and I who are changing the trajectory of health for hundreds of women or hundreds of families beyond that, right? If that has a trickle effect or a domino effect. And just because it doesn't look absolutely conventional, or doesn't have a research study to back it, or doesn't have, like, you know, peer-reviewed statistics and meta-analyses, does not mean it's not valid. It just means it's not controllable. It's not one variable that can be manipulated. And so, yeah, I don't know. It's just one other thought that came up.
It's like, I'll bring it back. I have a quote we're going to end with, but we'll go down that a little bit and then I'll bring us back, because, right, it's these things, you know, I could talk about my pain-free pregnancy protocol, which is like it's a lot of stuff. My poor clients, sometimes they get in there and they're like, I've tried to organize it. We're getting there. No, it's great. They all love it. I'm just, when you try, it's like, it is clear, but also it's not just, oh, here's one, like we can do this for one group and not do it for the other group. I mean, you could test the whole thing but it's not one thing that you're changing, as you said, which then, you know, it's like, oh, it would just never be studied. Like, it's something that would never, you know, there would be no fun. Like, it just, women's health we know more about livestock. Like, there's more like livestock for like lactation and all of these things. Like, we know way more about livestock than we know about humans, which if you're just looking at research, which makes sense because we don't want to do experiments on humans, especially pregnant humans, that could hurt, you know, future babies, because that's unethical. But it's just, there's this gap of knowledge, but also there's not, like, there is so much knowledge, right? And there's people that have experience. And I mean, there's traditional wisdom. A lot of my approach is not, and my inspiration came from the work of Weston A. Price, because he looked at traditional wisdom and you saw, okay, these are societies that thrive and they figured this out over the past, you know, few thousand years. What are they doing? Oh, hey, they're all doing similar things in different contexts. And this is not unique to, like, it wasn't, oh, they're different, like, racial groups, like, can, you know, have different physical profiles. It's like, no, there's a human biological blueprint, and it is meant to thrive when given the right circumstances, right? Just like a house plant, like, you see plants, you give them the right circumstances, they grow, they bloom, they're beautiful. If you put them in a dark corner and you don't give them any water and their soil's all moldy and, like, never fertilize them, like, they don't do well, then they die.
Not rocket science.
But and I'll bring it to the close. I think the other thing is, you will be let down by the standard medical model in preconception through, I mean, your entire pregnancy, but like preconception through week 12, you will get nothing, close to nothing, right? If you're very sick, as you mentioned, and that I had both of my HD clients, one was able to get a bit more care because she was a nurse. So she was, you know, in the system, so she was able to get care quicker. But a lot of them, it's like, you can't get primary care. You're almost only limited to emergency care, which is in the US is incredibly expensive. And just, you know, you talked about your appendix experience, long wait times. It's just not great quality care. And so that is just, to me, it's devastating. Like, and that's also the time when your baby is growing most rapidly and developing most rapidly. And it's such an important time. And there's just nothing available. And it's because our medical model can't capitalize on it, right? And so, you know, sometimes people give people like you or me a hard time. Sometimes I give, you know, like scaring women, or, you know, oh, making this to like sell your program, like, you know, giving me, I don't know if you get that.
Yeah. I do. Like, how unethical of you to sell the answers. And I'm like, no, I'm selling hundreds of hours of research
I know.
that is founded upon more than a decade. Like I could have bought a house for how much knowledge is in this brain, how much I've spent. And
Yeah.
I'm going to sell it to you for $97 because I don't have the time and accessibility to do it for every woman out there in an individual basis. And you're going to like, shut up.
I got a comment yesterday. I had like a Q&A box. She's like, could you just write a book? So this is like, so I can get it for like free or really cheap. And I'm like, oh yeah, honey. You're like, sure, I'll just like go write a book for you tomorrow. Like, no problem. Like, I don't have 2 kids and like a husband and anyway, that was like a me issue. I got very triggered by that. She wasn't mean, but it's just understanding, like, if you want good quality service, the person providing it to you has to be funded in some way. And I'm not, right, you have to understand the way that your OBGYN or standard medical provider is funded is if you are ill, if something goes wrong. Your OBGYN has no incentive to give you an intervention-free birth because they will make less money if that happens. Now, I'm not saying OBGYNs are bad people and they want you to have a C-section, or they want you to have a traumatic birth. There's those people out there. The vast majority are kind people that want to help women, but you cannot escape the influence of the system that you are in. And you cannot, as a doctor, go and give someone a 2-hour appointment that insurance won't, to educate them on a topic that they typically don't know. But let's say, women go in, they're like, oh, I'll go in for my annual exam, and then my OBGYN will tell me how to prepare for pregnancy. And then they come out super disappointed because they'll get 5 minutes of like, nothing really, take a prenatal, everything looks good, and bye. And it's because, well, that's all you're paying for. Right. And that's all that the insurance really, in the US, what decides what kind of care you can get is your insurance company tells your doctor what they can bill. And so if your insurance company doesn't say, oh, like, this is something we cover, your doctor is like, well, I can't bill for it. Like, it's a broken system in this. And so what I want women to understand is that you will get what you pay for. And this doesn't mean you have to spend tons and tons of money. Both your and my resources, we make things accessible, and some of the tools, yes, like supplements cost money. Some tools cost money. A lot of stuff is free, but I mean, like, you got to pay for things in life, right? And I just want women to understand that if you just go to your OBGYN, or like they have no way to, they cannot get paid to give you the service that you are desiring to get for them, which is why you can't get it beyond like the deeper systemic issues of the tools they have available, and what the pharmaceutical like roots of our Western medical system. I feel like that's something that women miss, because I have thousands and thousands of women that come to me like, I'm so disappointed. Like, I went to and like, they didn't tell me how to do preconception prep. And I'm like, that's why. And I think the same is true for first trimester. I think this also gets like first trimester, the lack of first trimester care is just the lack of value for life because it's small. And it's like, well, worst case, you just miscarry and that's not a big deal. No, that is a big deal to women. And that is a life that is getting lost. And oftentimes those are preventable losses. Not every time, but oftentimes there are risk factors. There are things that are happening behind the scenes that contributed. And those are things that you can identify and support prior to pregnancy. And I just see that that's not something they care about. And you can tell that because they won't even consider treatment until you've had further diagnosis or treatment until you've had 3 recurring miscarriages. So if they view those as a significant loss or something that's important, then it would be one, and let's figure out what's happening. Let's do everything in our power to make sure this doesn't happen again. And women just don't get that.
It comes up because disease is the focus, not optimizing physiology, right? Like, I did miscarry before my pregnancy that I had last. And I think that was a talk, like I was in a moldy exposure, right? Like, looking back, I'm like, no wonder my body was like, no, we do not have things in order here to sustain this, right? And it's just, Yeah, we really do need to understand the limitations of the system. And once we just acknowledge that and we're just honest with that and we stop trying to bark up the wrong tree for the answers that we want, and we, like, what is a few hundred or a few $1,000s investment? Granted, people don't have it. Some people
Yeah.
definitely don't have it, but
A lot of
that is
people
going
do.
to save you
Yeah.
so much in the long run. That is going to save you days spent not sick, not going to
Yeah.
work, weeks, where you aren't able to do things around the house. Like, it's just, it really is like something where priority should be given to optimizing, to understanding. It should be in our healthcare system. It's not. It's unfortunate that it's not, but we are here trying to change that. I mean, I got accepted into medical school and physiotherapy school, and I
Yeah.
went to physiotherapy school because I thought, I'm going to be surrounded by the idea all the time that if I like prescribe something, I make more money or whatever. I'm like, how am I going to fight that bias all the time? Like, that was just something that weighed on me in the beginning of like, I don't want to be that, but I don't know how you avoid that, even with the best intentions ahead of time. Or like, how am I not going to when I only have 5 minutes to talk to somebody and they're expecting an answer right away? Like, I've got to give them something. So I'll give them the lowest hanging fruit, or like, you know what I mean? Whereas my idea of like going into physiotherapy was, I'm going to be able to talk to people about their bodies. I'm going to be able to show them how their bodies work. I'm going to be able to have an hour with them instead of 5 or 7 minutes. In Canada, it's allocated at 7 minutes. And I was really into sport and physical activity at the time. So that really became the basis. But now I'm so thankful that was my trajectory, because it gave me such a strong foundation of anatomy and physiology. It gave me such a like mindset shift in how I would think about looking to understand the body, because I need to come up with like a solution for that or an answer. And it's only based on the tools. If I have someone that has a knee injury, I have to decide like what part of the knee is broken. Like, well, I can test this part, I can test this part, I can test this part. And I've just applied that kind of framework to the whole body, or to somebody's health, or to pregnancy, or whatever it is now. And we're just never going to find that in a system that, like you said, is making its means by who's funding it, right? And it's just a matter of it's just truth at this point.
Be aware of it, right? Be aware of it so you
I'm desperate
understand
to know
what
what
you're
this
getting.
quote is.
Okay.
This quote you have.
I know, I've got my quote. I'll see. Hopefully I find it quickly, but so Jess, it's been a pleasure to have you on the Welcoming Womb podcast. I'd love for you, please let anyone listening, if they want to connect with you further, if they are looking to get your course, I'm sorry, I don't know the name of your course, but just let them know how to connect with you, how to get more resources from you. Feel free to share that.
Yeah, so I think right now I'm hanging out mostly on Instagram. I don't really do anything on Facebook. Instagram seems the easiest. In the bio, I have a stand store, and it has links to any of my freebies. I have like a first trimester holistic pregnancy, kind of just things to be mindful of. I have a free downloadable PDF around the 5 causes of HG and just better understanding those. I have my healing HG course, which is available there. So most of my resources are funneled into Instagram. I do have a website again, but you're going to see all of that information kind of played out on Instagram. So my Instagram handle is the_wellness_element. The name of my business is The Wellness Element. And more recently, I'm just starting a podcast myself as well, the Wellness Element podcast. So I don't have anything on HG there yet, but I think like I will definitely have you on there, and we'll be able to talk about pregnancy, and I'll be adding stuff as time goes on down the line. So yeah, just a longer format like we have here, where we can really dig into this and really explain it and really lay some context around these issues so that people can hear. And I think that's how my healing journey really started. I was listening to podcast after podcast after podcast, and I started going like, oh my God, I sound exactly like this person. What do they have? Like I wait till the end of it, and I'm like, okay, they had Hashimoto's. And then I'm like listening, and I'm like, oh my God, that's exactly like my story. What do they have? Lyme disease. Okay. So I ruled in or out that list of my problems for myself personally based on hearing other people's stories and what worked for them and what didn't. And I kind of just kept feeling like, ooh, that's me. Oh, that's me. And it hovered around 2 or 3 different topics. So I think it's so valuable that you and I have like this type of long format conversation that we can have, because it gives people an opportunity to see themselves in our story and to find an opportunity to say like, this is the person for me to help me. This is the fit for me. So if that is the feeling that they're getting, definitely either check out your page or my page, or stay tuned to whatever we talk about in the future, because I'm sure we're going to have some other conversation. I feel like we can have lots.
Yes, no, I love it. And if you've never worked with me before and you are a woman dealing with HG, definitely connect with Jess at the Wellness Element, because I don't have the infrastructure to support you. I do have the knowledge, but I don't have the infrastructure currently, which is why I wanted to bring this resource to the podcast and just have a way to easily connect women with your resource, because it's like devastating to know, I'm like, there's that woman out there suffering, and I have the knowledge to help her, but I don't have the platform or the tool to facilitate it for that specific woman in that position.
Yeah, and I feel likewise the exact same about you, right? Like I have all the knowledge to walk someone through like
Yeah.
preparing their body for pregnancy, but I really see, there was so long, and this is the last thing I want to like leave you with. I know we're
That's
both like
fine.
talkers, but for so long I wanted to like go to the medical system after every one of my experiences and be like, see, this is the
Yeah.
solution. This is what I like. Don't you want to hear what I have to say? Don't you want to hear what worked for me? Don't you want like, what if this information helps somebody else? And it was
Yeah.
always, the door's always closing on it. They
Mm.
don't like, there's not time, there's not energy, there's not space for that, right? And so I kept thinking like, well, maybe I'll just make myself a position, myself it to the hospital. I'll just operate in this position, which will save them money. So then they'll have to listen to what I say. And then I'll change the trajectory of people's health that way. And it just got to the point where that's never going to happen. And
Yeah.
so my goal now has really been to find and collaborate with like-minded.
Yeah.
This happens to be that almost everybody's a woman,
Yeah.
but like-minded women who are really teaching us to take back our own power, our own intuition, our own wisdom, and heal ourselves, heal our family, heal the emotional trauma in our like generational lineage, like whatever it is, and just like use each other as resources. Like I am on a mission right now to build a collective of like true healers, like women who are healing the planet, each other, their babies, whatever it is. And so it's so nice that, you could be the go-to in terms of preparing your body. And, I can help if you're at that
Yeah.
point and didn't catch you earlier. And
Yeah.
so, just having this community, like I do not have the bandwidth for it all. I
I
always thought I
know.
could, I'm like, I could. I don't even have 3 hours to coach one person through it
I
in a week.
know. I know.
So it is like these
Ah.
platforms are amazing, and connecting with people like you is amazing. So
Well, thank you, Jess. I've loved this conversation so much. And quick thing, and then we're getting to our quote. I'm in that same spot where I love pregnant women. I love babies. And when I went through that experience, just like when I'm around, like if I see a bump, I just want to like hug it and kiss it. It's like, no, there's a little baby in there. Like I'm just a little weird about that. And I saw there's so many problems so much suffering, so much preventable, avoidable, unnecessary suffering that women and babies go through. And I just want to figure out like, what can I do? And I saw that the window that I had the most opportunity, or the most like what was most missing, or where I can make the most change for women, was in that preconception period. And so that's why I just focused in on that. That's why I was like, I even said, I had to be like, had to say no to women who are pregnant and wanted help from me, having to say no, because I knew I needed to focus my resource so I could reach the most people and make the most impact. And so I've been thankful for that opportunity. As you said, there's so much out there in the collective, and people give social media flack, but I love Instagram. Like I've learned so much from it because I've been able to connect with practitioners that I would have never met, or been able to, maybe I met them once at a conference, but I wouldn't have been able to keep up to date with everything that they are doing. And so I'm just so thankful for it. It's brought so many great people into my life. And it just shows that tools can be used for good and for evil. And it's just focus on the good. I will leave us, unless you have anything else you would like to add, Jess, and then I will leave us with our quote. I might have to pause and then find it again, but I see my book. I'll see if I can find it quickly. I'm hoping the page is bookmarked. And if not, it's like creased. It just opened to the page I'm looking for. So this is from Childbirth Wisdom from the World's Oldest Societies, and it's by Judith Goldsmith. And this is just the section on morning sickness and cravings. And she introduces it with morning sickness is a condition that still perplexes us. Modern science has found no precise explanation for its occurrence and no guaranteed method for its prevention. And I would agree this book's a few years old, but I would still agree. I know I saw that new gene as well that there was all the news about, but I would still agree that the common consensus is we don't know why it happens. There's no treatment, there's no clear treatment. Or really there's treatment, but no clear way to prevent it. It happens to some women and it doesn't happen to others. So it is, however, one of the best known symptom among Western people. So when she looked at tradition in people, so she says, on the other hand, the earliest observations of tribal societies seem to indicate the infrequency of morning sickness. For example, Alice Hidrulica, a physician and early explorer who visited and investigated nearly all the tribes of North America, wrote in 1908 of the peoples he visited that pregnancy in its earlier stage generally interferes in no way with the woman's habits of life and occupation in any of the tribes. Functional disturbances and diseases of pregnancy are much less frequent and less serious than with white women. And this is westernized women, but that's what he's describing as white women. In 1936, anthropologist William Holden reported of the Yaqui woman of Sonora, Mexico. Pregnancy is a pleasure because she experiences its stimulating and exalting effects and little of the nausea and illness so common with white women. And what I love about those quotes is that it's a completely different worldview of pregnancy. And my goal, and this is something I felt like I had the gift of experiencing with my second pregnancy and also in aspects of my first pregnancy, but the pleasure and the joy of growing a new life and bringing it earthside and then nurturing. I mean, it goes on and on and on, but pregnancy can be such a beautiful time. And I think it's just one of the joys of life that the darkness of this world wants to steal from women and wants to deny women experiencing. And I'm just here to fight that. I know you are too. Thank you again so much, Jess. And if you want a last word, I'll give you a chance. And then I'll let you go.
Yeah, thanks so much for having me on here and for just sharing in this conversation. I think we could have, 5 more hours.
So
I'm pretty sure we could talk this into exhaustion. So maybe that means there will be a part 2 sometime or another conversation, because I think there's lots of things that we can share together.
We only went 7 minutes over our scheduled time, which I view as a win.
Okay.
I was hoping to be off, but I'm viewing that as a win. Thank you so much, Jess. I'm gonna stop I messed up. We're stopping the recording and then I'll also let you go. But this was so fun and
so good. Am I right? So good. Again, I trust that you enjoyed that conversation just as much as I did. It would be incredible if you enjoyed the podcast, if you would go and leave a review and screenshot it and send me that screenshot on Instagram with the tagline podcast review with those 2 words. I will actually send you a link to one of my courses completely free, right? So typically it's something you have to pay for. You can get a link completely free for leaving a review. And if you're a woman, if you're hearing this and like Jess mentioned, you are resonating and you're like, that sounds like me. Or if you want to go into a pregnancy feeling confident and empowered and like you understand the reason why women experience things like morning sickness or heartburn during pregnancy or fatigue or even more, complications like preeclampsia or hypertension, or all of these things, or why some women have more challenging births than others, and really get the knowledge to understand why that happens and the tools to put yourself in the best position possible to have your dream pregnancy, birth, and motherhood entry experience, then I would love to welcome you to the Baby Ready Body all access pass. And for listening to my podcast today, I actually have a link for 25% off your first month of membership. And that link is in the show notes below. So thank you so much for listening. And I look forward to having you back for the next episode. And that one is very exciting. And so we'll see you next week and have a great rest of your day.